So today's talk is one of our many virtual educational programs that we offer. We also do in-person programs and sometimes the hybrid combination of both. If you want to see what we're doing the rest of this summer and beyond, please go to pro.eventbrite.com. And that's where you'll see all the programs that we have currently up for registration. If you are not getting our newsletter in your mailbox, or you'd like to receive email updates about our events, then you can contact us by phone at 800-426-6806, and we'll make sure to add you to the list. I want to introduce Peggy Rost. She is a certified social worker associate and holds a master's of public administration. She joined us here at Parkinson's Resources full-time in 2021, but she's been working with us and in support of our clients for several years. She's experienced in counseling and case management in a variety of settings, which include community-based mental health treatment and also clinical care settings. She's especially interested in helping individuals overcome barriers to activities that support quality of life, as well as recognizing and treating mental health symptoms that are common in Parkinson's disease. So I'll let you take it away, Peggy.
Okay, thanks, Libby. I'll just take a moment and get my presentation up here. All right. Well, so today we'll be talking about mental health and how it pertains to Parkinson's. I would like to mention that this presentation will mostly target people living with Parkinson's disease. We are going to have another presentation in August from another therapist who's going to more specifically address the mental health for care partners. But hopefully today, even if you are a care partner, there will be something here for you to take away as well. So this is our agenda of what we'll be doing today. We'll start by defining mental health. We'll then talk more specifically about mental health and how it pertains to Parkinson's. We'll look into ways to maintain or improve mental health. We'll go over what to expect and what to look for in therapy. I'll introduce some ways to access services, and then we'll save some time at the end for questions. So what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. Factors that can contribute to mental health conditions include biological factors, such as genes or brain chemistry, life experience, and family history. And this definition was taken from the Substance Use and Mental Health Services Administration, also known as SAMHSA. So when we're looking at mental health and Parkinson's, it's extra important to consider this because Parkinson's introduces both a biological factor, such as the chemical changes that happen in the brain due to Parkinson's disease, and it also presents a challenging life transition or life experience of accepting and managing a chronic progressive condition. And then, of course, people who have Parkinson's also have a family history and different relationships, possibly trauma, other life experience beyond their Parkinson's that can contribute to their mental health state. I'm first going to talk about anxiety. I would say this is probably the most common complaint I hear from clients when I'm seeing them for mental health counseling. They'll describe just feeling sort of an increased feeling of anxiety, of sort of baseline physical feeling of being very keyed up or on edge. And this is partially because anxiety is a clinical symptom of Parkinson's due to the dopamine changes in the brain. There are also other non-motor symptoms of Parkinson's that can exacerbate anxiety. So for example, Parkinson's affects executive functioning, which often leads to anxiety around completing tasks and adjusting to unexpected events. Changes in speech are also a non-motor symptom of Parkinson's, which also I find can be very intertwined with anxiety. As people have changes in their speech, they feel very anxious that they won't be able to participate in conversations with others or respond in a way that they really want to. And then it's also important to consider that anxiety can actually be a wearing off symptom of Parkinson's medication. So what I mean by this is if you're on carbidopa-levodopa, you're on a dosing schedule, and let's say you're taking your carbidopa every 4 hours, you might realize that you're feeling really anxious around hour 3 or 3.5, and that could possibly be because the medication is wearing off. So it can be helpful just to track medications and symptoms, and if you're noticing a pattern like that, discuss it with your doctor to alter your dosing schedule. So these kind of cover the biological aspects of anxiety with Parkinson's. And then we also have the life experience of having Parkinson's, which can also contribute to anxiety. So with having a progressive chronic disease like Parkinson's, there's uncertainty of the future. I know you're all told that Parkinson's looks differently for everybody, so there is uncertainty of what symptoms might be and how rapidly they might progress. So there's, of course, a lot of anxiety there. Anxiety can also be a product of just feeling very different in your body and in your mind due to Parkinson's. It really takes a lot of adjustment to kind of find your way in the world again after getting diagnosed with Parkinson's and really feeling the effects of it. And then people often feel quite anxious about how their Parkinson's will impact the people that they love and what changes will it entail. Depression and apathy are also clinical symptoms of Parkinson's. So depression is described as having a loss of interest in things that were once enjoyed, and can also have some changes in biological factors like appetite and sleep patterns, having an overall feeling of sadness for most days. Of course, as human beings, we're all going to have times where we feel sad, but if that sadness or lack of pleasure in things is really persisting, that's when we want to start sort of screening for depression. The same pathways that create dopamine in the brain also create the brain chemical serotonin, which regulates mood, appetite, and sleep. So here, similar to anxiety, the difference in the chemical balances create this symptom of depression. And then, of course, also like anxiety, the life experience of having Parkinson's can contribute to feelings of depression. And, there might be grief of what the future is going to look like, depression about the change in physical abilities, or perhaps the change in relationship dynamics. Apathy is also very common in Parkinson's, and again, is a result of the chemical change in the brain. So apathy is our dopamine is our reward chemical. So when we're lacking it, we don't have that same drive or motivation to do things. And apathy can show up cognitively, where people might just have a loss of interest or curiosity in new things. It can show up emotionally, where one lacks the passion or reaction to situations that would normally get them excited or evoke some sort of emotion. And it can also show up in a behavioral way, where the person has trouble initiating an activity or following through with things. So now I'd like to discuss some ways that we can actually improve some of these aspects of mental health when living with Parkinson's. So social connection and diet and exercise are definitely helpful. Interacting with others in general is very important to keep up mental health, and also interacting with others who have Parkinson's can be greatly helpful as well, because you're talking with people who truly understand what you're going through. Diet and exercise are also helpful contributors to good mental health. Healthful eating that provides nutrients and reduces inflammation can be good for mood. And exercise, as I'm sure most of you know, is the #1 way to manage the progression of Parkinson's, but it also gets the feel-good chemicals moving in the brain and can also provide a really great sense of empowerment or accomplishment and structure to one's day. So I'm not going to spend any more time on those things, because we have other educational events throughout the year that really dive deep into those. And you're also welcome to call Pro and ask more about what we offer for exercise and social connection. And we'll shift down to these bottom ways to improve mental health. Medication can be helpful. So you could talk to your primary care or neurologist if you're noticing that you're feeling more lingering feelings of sadness or depression or anxiety, and they can prescribe something that will work well with the medications that you're already on. Both neurologists and primary care providers can do this, or you could also ask to consult with a psychiatrist or even a neuropsychiatrist. So the bulk of this presentation will talk more about mindfulness and individual therapy. So mindfulness, it can be its own practice, and we'll talk a little bit more about that. And it's also incorporated into a lot of frameworks of therapy. So John Kabat-Zinn, who created an 8-week program called Mindfulness-Based Stress Reduction, defines mindfulness as awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So mindfulness really just means that we notice and observe feelings rather than judge or resist them, which often increases our internal suffering. Mindfulness can take many forms. It can be a seated meditation, where you're just really focusing inward and maybe watching the breath. It can be a form of movement, like yoga or Tai Chi are really mindful forms of exercise. And mindfulness can even take place in your daily tasks. If you focus on something like washing the dishes and say to yourself, I'm only going to focus on washing this dish and paying attention to how it feels in my hand or how it looks, that can even be a form of mindfulness. There are some apps that are pretty popular these days that can help with mindfulness. They have audio guided meditations that might lead you through a visualization or a form of breath work. So I recommend checking those out. There are also mindfulness classes. We have one offered here at Pro, and I know there are other organizations that offer this as well. So you could definitely look into organizations in your community to see what's around. And mindfulness can be particularly helpful when managing a progressive disease because it is helping you stay connected to the present moment and not getting carried away so far into the future. And then, as I mentioned before, mindfulness is often being incorporated into therapists' work with clients. And that'll bring us to what we expect in therapy. And this is one of my favorite little New Yorker cartoons here. So in therapy, and I thought it would be helpful to present this because often when I'm working with clients at Pro who have come to use my services and we're talking about maybe doing counseling or setting them up with a therapist in the community, they've had no experience with therapy before, and it was Parkinson's that really drove them to pursue this. So hopefully it'll be helpful just to hear a little bit more about what you could expect in therapy. There are many different models and approaches. I do see value in talk therapy where the therapist is really reflectively listening to you and helping you process thoughts or emotions. So there is value in that for sure. And therapists will often bring a particular model or framework that they like to use to help their clients achieve their goals in therapy. I think a lot of people have this notion that, oh, I don't want to go to therapy. I don't see how, whining about my problems is going to help anything. But therapy is not really like that. There's really an objective for it or a goal, and it can be very proactive. It can be a space to even just articulate or say out loud things that you've had going on inside for a long time, and say them to a person who's an objective sounding board. Therapy is also a way to form a human connection. In therapy, you can share things that you might not want to necessarily share with your friends or family. And when you begin therapy, you'll likely receive an assessment from the therapist. So they'll ask you lots of questions to really get a broad picture of what your situation is, who's in your life, how is your living situation, who's important to you, what are your strengths, and if they are billing insurance, they'll need to come up with a diagnosis from the DSM for you to show that providing therapy is medically necessary. And then from there on, you will develop a treatment plan, what your goals are and what you'd like to work on, and collaboratively work on that with the therapist. People often ask me how to prepare for therapy, and I'd say the number one thing to do is really just have something in mind that you want to be different. You could have a very specific goal in mind, like I want to learn some coping skills for when I feel anxious, or it could be broader and more general, like I want to improve some of my relationships with my friends and family. And the therapist will work with you to help determine what your goal is too when they first meet you. I would say bring an open mind to try something new. Therapy is going to bring some things to light and encourage you to look at things in a different way. And some of it might feel kind of weird or different. So I think if you have the open mind just to try something you haven't before, that can really bring a lot of success in therapy. And of course, it's really important that you have willingness to give feedback to the therapist. I would say most therapists really want their work with you to be centered on you, and will look to you to kind of guide them on how they can help you. So it's really important to let a therapist know if something's not working or it wasn't helpful. That can really help guide the process. And then you also really need to bring your commitment to engage in the work. So just, having the idea of what you want to change, and being willing to really show up and participate. So here are some things to look for in a therapist. So depending on your financial situation, you'll want to decide if you need to find a therapist in your insurance network or if you're able to pay out of pocket for therapy. What some therapists are doing these days too is providing a super bill. So they will be out of network with your insurance, but they can provide you with a super bill, which some insurances will then reimburse you for the service. So that could be something to look into. You could consider what the path of training the therapist has had is. So here in Oregon, the most common sort of schools that lead to one becoming a therapist are social work school. So a therapist can be a licensed clinical social worker. They could be a licensed professional counselor or a psychologist. So they're all different paths of education that lead to one becoming a therapist. You might see, as you're looking at different therapy profiles or learning about a therapist, that they're licensed or unlicensed. Licensed means they've gone through the process of having a certain number of years of experience and supervision, and passing a board exam. Unlicensed means the clinician is working towards that goal and they're working under the supervision of somebody who's already licensed. So, I think both can really bring great things to therapy. Nowadays, you'll want to consider, do you want to meet in person or are you okay with telehealth? I'd say most therapists are not 100% in person anymore. I think the majority are offering at least some telehealth. Many are doing only telehealth. I would encourage you, if you're feeling resistant to the telehealth, but that's all you can find when you're searching for a therapist, I would encourage you to be open to it and give it a try. I love an in-person connection, but being on both sides, therapist and client of therapy, I've been surprised at how effective working over telehealth can be as well. You might like to talk with a therapist about what their approach is or what kind of framework they like to use. And above all, I think rapport and connection is the most important thing when looking for a therapist. So if you connect with one, you'll usually be able to have like a quick 15-minute phone call with them just to have a discussion about what you're looking for and get a little feel for them. So if you get a good feeling from that conversation, you can move forward with the therapy appointment. If you're finding, 3 sessions in, it's not really working for you, then, I would try having a conversation with the therapist, or if it's just not feeling like a good fit, I would try to find somebody else. Because if you don't have that rapport or that connection, no matter what approach or framework the therapist uses, you're likely just not really going to open up and feel you can engage if the fit isn't right. I found there are a few myths about what therapy is, and might be helpful to mention what it is not. So it's not a quick fix. And I know many of us, when we're going through something hard, really do want a quick fix. But therapy is a process and it takes time. And I think with therapy, flow can actually be fast. So sort of adjusting your expectations of the length of the process. A therapist is not going to just, sit there and give advice. You're the expert of your life. Nobody knows your life better than you. What the therapist can do is, be a sounding board or provide some perspective, but they aren't really going to, dole out advice or help predict the future of what you should or shouldn't do. I'd like to share a little passage from a book by Russ Harris, who contributes to a model of therapy called acceptance commitment therapy, which I'll talk about in a moment. But I think this passage really describes the relationship between client and therapist quite well. You know, a lot of people come to therapy believing that the therapist is some sort of enlightened being, that he's resolved all his issues, that he's got it all together. But that's not the way it is. It's more like you're climbing your mountain over there and I'm climbing my mountain over here. And from where I am on my mountain, I can see on your mountain that you can't see. Or I can see things on your mountain that you can't see. Like there's an avalanche about to happen, or there's an alternative pathway you could take, or you're not using your pickaxe effectively. But I'd hate for you to think that I've reached the top of my mountain and I'm sitting back taking it easy. Fact is, I'm still climbing, still making mistakes, and still learning from them. And basically, we're all the same. We're all climbing our mountain until the day we die. But here's the thing, you can get better and better at climbing and better at learning to appreciate the journey. And that's what the work we do here is all about. So again, you know, the therapist is not an expert or future predictor. They can just see something differently because they're on their mountain and can see you over on your mountain. So now I'll go through just a few of common therapy approaches. There are many, and this is truly just a handful. The first is cognitive behavioral therapy, which is probably the most well-known form of therapy. And it's a type of behavioral therapy in which behavioral changes occur by learning to modify dysfunctional thought patterns. Different exercises are used to help clients understand the relationship between their thoughts, feelings, and behaviors, and can then change patterns of thinking to cope with stressors in a more helpful way. Cognitive therapy is also known as CBT, and it really drives home the notion that our thoughts, feelings, and behaviors are all related. So if we alter one, the other two can change as well. A second model is acceptance commitment therapy, also known as ACT, which I mentioned a moment ago. And this model therapy stems from CBT, but instead of trying to change difficult emotions, the client is encouraged to accept their existence while still moving forward in their lives. ACT encourages clients to identify values or what's important to them, and then commit to actions that align with those values. I find this model particularly helpful for those living with a chronic illness. It can also be helpful for overcoming apathy. For example, this model, as I said, encourages clients to think about what's important to them and what they value, and then commit to things that will bring them towards that value. So an example might be that a woman with Parkinson's wants to be a present grandmother. That's something that she really values. So she's going to commit to going to her granddaughter's dance recitals, even though she feels self-conscious using a walker in public because of her Parkinson's. So it's accepting those uncomfortable feelings of feeling self-conscious, but committing to the value anyway. ACT also incorporates mindfulness to help separate thoughts and difficult emotions from your whole self. So a popular sort of analogy is thoughts or difficult emotions can be, passing clouds in the sky or leaves drifting down a river. So ACT will help provide mindfulness exercises to help make that separation from a difficult thought from your whole being. And then a third model I'd like to mention is dialectical behavioral therapy, also known as DBT. And the dialectical part of this title refers to the fact that two things can be true at the same time. That Parkinson's is a really tricky disease to manage, and I have really good resources and support to help me do it. So it's not one or the other, both can be true at the same time. This is a type of behavioral therapy that aims to change behavioral, emotional, and cognitive patterns associated with dysfunction by helping clients improve their emotional and cognitive regulation. DBT aims to develop specific skills such as mindfulness, again, distress tolerance, emotional regulation, and interpersonal effectiveness. There are also some DBT skill groups out there where that can be very helpful, where you're in a group led by a therapist with other clients who are learning the skills for emotional regulation or mindfulness or interpersonal effectiveness. That was just a little appetizer of the many models that are out there. And now I'd like to talk about how therapy can help manage Parkinson's. So some things you might cover in therapy could include communication skills. These are really important when dealing with Parkinson's because your needs with Parkinson's are ever changing, and therapy could be a place where you could learn how to better communicate those needs to your friends, family, or care team. Better communication will also, in turn, improve relationships. And another way to improve relationships in therapy is to have it be a space to process things like anger or fear so that they don't interfere as much in your personal relationships. Therapy could be a place where you learn some coping techniques for Parkinson's symptoms. It could be something like breath work for managing anxiety, or learning ways to alter your emotional response to a difficult aspect of Parkinson's. It can also be a place to process grief that's associated with living with Parkinson's. That might entail, grieving the changes in physical ability or grieving the change within a relationship. Also just grieving the changes that happen with life transitions. I'd say on average, most people are diagnosed with Parkinson's at a time that they also might be going through retirement or having friends or family or peers who are dealing with illness or death. So there's a lot of grief there. And then therapy can also be a place to work on finding acceptance with Parkinson's. And this doesn't mean, surrendering to it or feeling happy about it, but making somewhat of a peace treaty with the existence of Parkinson's. It's not going away, but your relationship with it can change, and therapy can be a place to work on that. So when trying to find a therapist for Parkinson's, there are a few things to consider. Often we get calls from people requesting a therapist who has expertise or knowledge of Parkinson's, and I think that's definitely helpful. I don't think it's a deal breaker. I think if the therapist has experience or knowledge of working with clients with chronic illness, that is going to be really beneficial. I think most therapists will take it upon themselves to learn about a disease that one of their clients has. And then we here at Pro could also always be a resource to therapists. So let's say you started working with a therapist, but they don't really know much about Parkinson's. You could definitely connect them with Pro, and we can provide educational material. When you're first getting started with the therapist, I would definitely talk with them about their attendance or no-show policy. As you all know, Parkinson's symptoms can really fluctuate, and you might wake up just having a really tough day where you can't get up, out of the house for your appointment, or signing onto the computer for your telehealth appointment feels too hard. I would definitely discuss this with the therapist up front, talk with them, see what they need in terms of notice for canceling or rescheduling an appointment, or maybe it would make sense to do a shorter appointment, like a half hour or 45-minute appointment, something that's going to work for both you and the therapist. I would try to line up therapy appointments with your on times. If there's a time of day that you feel particularly good, I would try to have your therapist appointment then, just so that you can fully engage and participate. And then I would also talk with your therapist about the frequency of appointments. When you're dealing with Parkinson's, you're often juggling a lot of other appointments, maybe speech therapy, medical appointments, physical therapy, exercise class. So while therapy is very helpful, we don't want it to be a thing that's going to overwhelm you or just make you feel overscheduled. So talk with the therapist about what kind of schedule would help you keep up the momentum in your work together, but not overwhelm you with all the other things you have to manage. So there are a few ways to access therapists, and I do want to just acknowledge the tough reality that finding a therapist is pretty hard right now. There are just not enough mental health providers. So it can take time and requires a lot of persistence to find a therapist. You could start, if finding someone in your insurance network is very important to you, you could start by asking your insurance company for a list of providers. They likely won't be able to tell you if the therapist has current openings, so that will mean that you'll need to make phone calls and ask, but that could be a good starting point. You could try asking your primary care provider for a referral. Some primary care offices have social workers or behavioral therapists who can help get you started or refer you to other people in their network. If you're comfortable asking friends and family and other communities, if anyone has a therapist they like that they could recommend, that could be a place to find a therapist. You don't want to find, the same therapist as someone very close to you is using, but someone in your broader community could be somebody to ask. The Psychology Today website is a good place to look. So you go on there and you can filter for what you're looking for. So you could put in, looking for a therapist in Portland, Oregon, who accepts Medicare, who has knowledge of chronic illness. They're all little filters you can check. And then you'll get a list of profiles of people that fit that criteria. Therapy Den is a similar website as Psychology Today. And then you can also call us here at Pro. We've tried to keep a list of therapists who have said they have interest in working with Parkinson's or chronic disease. So we keep the list. It's pretty impossible for us to know, again, who has openings or if they're, if they're in network with different insurances, but we're happy to share the information that we do have. And then I wanted to mention the Pro social work services that are offered here. We offer free short-term counseling, which is usually up to 6 sessions. It needs to be Parkinson centered. So you wouldn't come to us if you're looking for, working on deep-seated issues in your marriage or something like that. We'd really want to focus our work on managing a new diagnosis or some sort of transition in the disease that's impacting your mental health. The service we offer can be used to address something very specific like a new diagnosis, or I'm finding that my service here can be sort of an intro to therapy for a lot of people. As I mentioned, many people haven't gone to therapy before, and my work with them allows them a chance just to get used to sitting in a room with somebody and sharing vulnerable things and going a little bit deeper into their emotions. So it can be kind of a therapy light or introduction. Our service here can also serve as a bridge while someone's on the wait list for a therapist. So they might have found a therapist that takes their insurance, but the therapist has a 2-month waiting list. So we can help provide support in that time. And the counseling services here are available to people with Parkinson's and care partners. I do want to mention there is currently a wait list for this service as we're looking at a transition in our social work role here, but it will be something we offer again once we have the right person on board. Please don't hesitate to still call us and just let us know you're interested in counseling if that's the case. And there might be other programs here that we offer that can help your mental health, like our peer-to-peer mentor program or support groups or even an exercise class. So definitely give us a call and we can tell you what we offer. And I've just listed some resources here that I mentioned earlier in the presentation if you want to take note of them. So the top one is the one that Libby mentioned in the beginning. That's where you can see all of our events and classes that we offer. Psychology Today and Therapy Den are the websites where you can search for therapists. And Insight Timer and Calm are the mindfulness apps. And I'll leave that up and would love to turn it over to you all. And if anyone has questions, I'm happy to answer them. And do you want to stop recording, Libby, if you haven't already?
Thanks, Peggy, for that presentation. And this will end our recording.